By having the different coils that are part of the EMBOLD platform, it allows me to focus on each individual aspect of a case and select the coil which best suits the needs at that moment in time.
Well, the example that comes to mind with the packing coil is a splenic artery aneurysm. A lot of what we're trying to accomplish in a splenic artery aneurysm is a very dense pack, and being able to not have to worry about sizing in an aneurysm and just use a very long noodle-like coil that conforms to the aneurysm itself is extremely valuable, and being able to put several of those into an aneurysm sac easily makes the procedure much faster.
I think that's a very nice addition to the whole portfolio, having the packing coil, and at those such long lengths of up to 60 centimeters.
Now that we have the packing available, we work within a frame created by the EMBOLD Fibered Coils, and the packing coils allow us to achieve that 24 or 25% packing density that we really need to ensure long-term success after embolization. I think Soft has more of an interesting role in smaller vessels that maybe are a little bit more difficult to selectively catheterize. And in those vessels, when they're small in size and maybe there's a little bit of a risk of catheter kickback, we'll oftentimes start with the soft coils in those vessels. They have a high volume relative to other coils we use in an O2 through an O2-1 microcatheter, and they do the job really nicely.